Hello everyone. In this video, we are going to learn about the normal puerperium, its physiology and duration. The puerperium, or postpartum period, is the time right after a baby is born. During this time, the mother's body slowly returns to the way it was before pregnancy. It usually takes about 6 weeks, and that's why it's also called the fourth trimester of pregnancy. Let's talk about the duration of the puerperium. Traditionally, it is considered to last 6 weeks, or 42 days after delivery. According to the World Health Organization, the first 6 weeks are the most critical for a mother's recovery. However, some body changes, like those in the heart, blood vessels, and muscles, may take up to 3 months to return to normal. Let's talk about the types of puerperium in detail. The puerperium, or postpartum period, is the time after childbirth when a mother's body gradually returns to its pre-pregnancy state. This period is traditionally divided into 3 types. Immediate puerperium. This is the first 24 hours after delivery. The mother experiences rapid physiological changes. The uterus begins contracting. Vital signs stabilize, and bleeding is closely monitored. Hormonal shifts occur quickly, with placental hormones dropping and oxytocin levels rising to aid uterine contraction and milk ejection. This period is critical for preventing complications such as postpartum hemorrhage and thromboembolism. Early puerperium. This spans from day 2 to day 7 after delivery. The mother continues to recover physiologically. The uterus involutes. Lochia changes from red to pinkish brown, and vital signs stabilize further. Lactation becomes established, and the mother starts taking a more active role in caring for the baby. Psychological adaptation begins, often corresponding to the taking hold phase, where she starts gaining confidence in baby care. Late puerperium. This period extends from day 8 up to 6 weeks postpartum. Continued recovery occurs. The reproductive organs return fully to their pre-pregnancy state. The pelvic floor regains strength, and breastfeeding is maintained. Some physiological changes, such as cardiovascular adaptations or musculoskeletal recovery, may continue for up to 3 months. Psychologically, the mother enters the letting go phase, fully accepting her role and establishing independence. All this ending soon. Point monitor. Maternal recovery, strong. Identify complications early, strong, and provide appropriate support, strong, during each stage of the puerperium, seen. Let's talk about the physiological changes in the puerperium, starting with the uterus. Immediately after delivery, the uterus weighs about 1,000 grams. By 1 week, it's reduced to around 500 grams. At 2 weeks, about 300 grams. And by 6 weeks, it reaches 60 to 80 grams, which is the normal, non-pregnant size. Now about the fundal height. Right after delivery, it lies midway between the pubic bone and the umbilicus. After 24 hours, it's at the level of the umbilicus. Then, it decreases by about 1 centimeter every day. Let's continue with the physiological changes in the puerperium. Second, Lochia, or uterine discharge. After delivery, the uterus expels a vaginal discharge called lochia. It changes in color and composition as healing takes place. From day 1 to day 4, it is called Lochia rubra, bright red, made up of blood and tissue. From day 5 to day 10, it becomes Lochia serosa, pinkish or brown in color. After about 10 days, it changes to Lochia alba, whitish or yellow, and this may last up to 4 to 6 weeks. Third, the cervix, vagina, and pelvic floor. Immediately after birth, the cervix is soft and floppy. By the end of 1 week, it starts regaining its tone, though the opening may look different from before pregnancy. The vagina, which becomes stretched during delivery, gradually shrinks back, and the normal folds called rugae usually reappear by about 3 weeks. The pelvic floor muscles, which are stretched and weakened in childbirth, recover slowly over time. Regular pelvic floor exercises, like Kegels, can greatly help in restoring strength and preventing problems like incontinence. Let's talk about endocrine changes during the puerperium. After delivery, the levels of placental hormones like HCG, estrogen, progesterone, and HPL drop sharply. Prolactin, however, stays high in mothers who are breastfeeding, and this helps produce milk. Oxytocin also plays an important role. It helps the milk flow and makes the uterus contract. Ovarian function, or the return of menstrual cycles, depends on breastfeeding. In mothers who are not breastfeeding, periods usually return around 6 to 8 weeks. In breastfeeding mothers, this is delayed, a phenomenon called lactational amenorrhea. Let's talk about lactation and the changes in the breasts after childbirth. Breast milk develops in stages. First, in the first 2 to 3 days, the breasts produce colostrum, a thick yellow fluid rich in antibodies that helps protect the baby. From day 4 to 10, the milk changes to transitional milk, which is thinner and higher in calories. After about 2 weeks, mature milk is established, providing all the nutrients the baby needs for healthy growth. Let's talk about changes in the cardiovascular and urinary systems after delivery. Cardiovascular system. After childbirth, a mother's blood volume decreases because of fluid loss through urine called diuresis and excessive sweating called diaphoresis. Her heart function and cardiac output usually return to normal within about 2 weeks. However, the blood remains in a hypercoagulable state, meaning it clots more easily, which increases the risk of blood clots or thromboembolism during the postpartum period. Urinary system. In the first few days after delivery, the body gets rid of excess fluid through increased urination, which is called diuresis. The ureters and renal pelvis, which were slightly dilated during pregnancy, gradually return to their normal size within about 6 weeks. These changes are all part of the body's natural process of returning to its pre-pregnancy state. Let's talk about changes in the gastrointestinal and musculoskeletal systems after delivery. Gastrointestinal system. Constipation is common in the postpartum period. This happens partly because of the effect of progesterone, which slows down bowel movements, and partly because mothers may fear pain during bowel movements after delivery. On the positive side, the appetite usually returns quickly, helping the mother recover energy. Musculoskeletal system. The abdominal wall muscles that stretched during pregnancy regain tone slowly over time. Some women may experience separation of the abdominal muscles, called diastasis recti, which can persist for weeks or even months after delivery. Gentle exercises, under guidance, can help strengthen the abdominal muscles and support recovery. Let's talk about psychological adaptation in the puerperium. After childbirth, mothers go through a process of adapting to their new role in stages. 1. Taking in phase, first 1 to 2 days. During this phase, the mother is usually passive and focused on herself. She may be tired, need rest, and rely heavily on others for support while processing the experience of childbirth. 2. Taking hold phase, days 2 to 10. In this stage, the mother starts to take more responsibility for caring for her baby. She becomes more confident and interested in learning how to feed, change, and comfort her newborn, though she may still need reassurance. 3. Letting go phase. Here, the mother accepts her role fully and becomes more independent in caring for her baby. She also begins to integrate this new identity into her life, balancing personal and family needs. Postpartum blues. Many mothers experience mood swings, tearfulness, or irritability around days 3 to 5 after birth. This is called the postpartum blues, which is usually self-limiting and resolves within a couple of weeks. Understanding these stages helps families and healthcare providers support the mother emotionally during this important period or paragraph. Let's summarize the physiological changes during puerperium. The puerperium is the period of about 6 weeks after delivery. During this time, a mother's body undergoes physiological, hormonal, and psychological changes. The main goals of this period are the reproductive organs returning to their pre-pregnancy state. P. The establishment of lactation and successful breastfeeding. P. The adaptation to her new role and bonding with the baby. P. The all. Thank you so much for watching. We hope you found this video helpful, and we'll see you in the next video.